Medical professionals of Reddit, what is the craziest DIY treatment you've seen a patient attempt? We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed. So this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. Yep, I had a crack addict cut her thumb on her broken crack pipe. The thumb was incredibly infected. She grew tired waiting for the hand surgeon to arrive. He was in the operating room with another patient, so she bit her finger to release the pus. Then she left the hospital, cursing the staff the whole time because we are useless, etc. Neighbor came over to borrow a chainsaw. I noticed he had a thick bandage around his arm and asked him what happened. He said he fell out of a tree last week and cut his arm. I asked if he got stitches and he said he just wrapped it and his family is praying over it. About 4 days later I seen his wife and she said he was really sick and may have the flu. Come to find out he had septicemia and dying. He died a week later of kidney failure and sepsis. I was getting a kick out of all the stories on here, but this one is just sad. I am not a medical professional, but my father-in-law had severe skin cancer. He basically had an open sore on his back for several years that bled and bled. We never knew about it until one day we saw a pancake-sized crater through his shirt. Went to the hospital finally and they basically said he has cancer throughout his whole body at this point. His response was he thought it was a cut that wouldn't heal and put gauze and neosporin on it. Yes, he is still alive but they didn't give him much time left. They managed to treat the wound but the cancer spread into his organs and bones. The sad part is it could have been avoided if he just went to the doctor years prior, but that is unfortunately the common mindset in a lot of older folks. God, that's terrible. I've found that sort of attitude is common among older people though, where they sort of shrug and get on with it. When my granddad was young he fell and dislocated his shoulder. He decided to just pop it back in himself and forget about it. It's never properly healed and still causes him pain so many years later. When I worked in my colleague had to see a guy with an ear problem. He had something stuck in his ear and had been trying to get it out. This wasn't a new thing. He'd been trying for some time. Turned out, he had completely removed his tympanic membrane, and the bits that were stuck in his ear and that he was trying to pick out with cotton buds and hair clips were his ossicles. Enjoy. I have consistent skin irritation in my ears and try and limit myself to sticking cotton buds in my ears to 4 times a week for relief. Thank you. You've cured me of this vice, and I'm setting myself on fire. Good day. Had a patient come into the ER with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, 1/2-inch deep gash in his leg. I go to pull the bandage off and as I'm peeling it away I notice the skin is completely black and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud and stuffing it into his leg. That's what all the black mossy stuff was. Hint, don't do this. Posted this before, but I think it applies to the thread. When I was an internal medicine resident I came across a very nice 50-year-old Dominican lady. She was well mannered but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed that she'd been seen by every single digestive disease MD in our hospital system. Not only that, she'd had every single procedure in the book, ranging from endoscopies up both holes and culminating in an exploratory laparotomy you open up to basically look inside you and we have no clue what's going on. All of this because for years she had one single complaint. She reported severe gnawing pain in her stomach. At this point I should mention that she was Spanish speaking only. Not only that, she had a very heavy Dominican accent, and I was the first Hispanic doctor to ever see her. My first language is Spanish and even I had difficulty understanding her. So she comes in and after exchanging some first time pleasantries I politely ask her how she's doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again, and asked for the cream to kill it. At this point I got intrigued. Her medication list only mentioned a cream used for herpes breakthroughs. The previous fellow only mentioned in his note that in every single visit she only asked for the cream and nothing else. When I asked what she meant by the biting and what she intended to do with the cream, she very calmly tells me she intended to stick the cream up her butt in order to kill the bird living inside her. After delving more deeply into her story, it turns out she didn't have a medical condition. Ever since she was a little girl, she believed she had after eating whole quail egg. The bird had spawned inside her and gnawed away in her insides whenever she was very hungry. After a short visit to psych, she was diagnosed with a somatic type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of 2 who paid her taxes and had 2 part-time jobs. I reached out to every digestive disease doctor in our hospital system once more to make sure she never receives an inappropriate invasive intervention. I've been following her now for 3 years and she's happy as one can be, considering she has a bird living inside her. TLDR. Lady complains of pain in her belly. Worst case of lost in translation ensues. Gets very invasive medical procedures. Turns out she's just cuckoo. I work in the ER at a trauma center. This guy comes in with his little girl and says that she was bit in the face by the family German Shepherd. I immediately take her back assuming that I need to control bleeding. What I encounter is a little girl with a laceration going all the way from over her left eye crossing her nose and mouth. It is not bleeding whatsoever and it seems to have an odd looking substance inside. So I obviously ask the dad what she got inside it. He responds very proudly with, "Ah yes. I pack the wound with tobacco from my cigarettes and super glue. Poor thing." Tobacco certainly has antibacterial properties, but pure tobacco, not a cigarette mix. During 3rd year med school I was on a neonatology rotation. Lots of premature babies or high risk births. We'd get code green page to us for please come to delivery room as able and code pink page for please come to delivery room stat. There was a pager that was the standard one that got paged for this, and usually it was whichever of us med students who was on call carrying it. Our job was then to get one of the nurse practitioners and possibly a second nurse and head over with the incubator etc. to take the baby and get her to the NICU. About 6 PM one evening as we're doing handover rounds, that pager goes off with a code pink. Then the NP's personal pager. Then the neonatologist's personal pager. The next 10 minutes are a bit of a scramble and not particularly interesting from the point of view I had, as I was assigned to send pages to additional people and fetch things. But in short, a teenage lady of local Aboriginal descent had come in suffering from very premature labor. I want to say 20 weeks, but could have been 22 or so. She and her ex-boyfriend had recently gotten back together. He had discovered she was pregnant. Believing that the baby was not his, he attempted to abort the baby by inserting a bamboo stick and trying to fish it out. She did not want said abortion so he attempted while she was asleep. Baby and mother survived. Relationship did not. Later testing showed the baby was indeed his for those wondering. One time, when I was in nursing school, I was doing a clinical and a guy came in with pain in his man part. Long story short, several days prior, he decided he wanted a dong texture implant to help enhance pleasure during intercourse for his lady friend. He and his buddy got drunk of course, and decided to do it themselves. So they went in his garage and took a box cutter to slice open the skin on the dorsal, top, side of his dong, made some room between the skin and underlying muscle, and put a small porcelain heart underneath. Then he superglued it shut. To make matters worse, the guy didn't wait for it to heal and decided to take it for a test run. He ended up with a major infection and presented several days later. I unfortunately don't know the outcome. I was just there for the porcelain heart extraction. Can't make this crap up. I've now worked in a surgical trauma ICU as an RN for 2 years, and people never cease to amaze me. Oh, the stories I have even as a student. One particular one that stuck with me was a lady who came into the hospital with back pain. Seeing as A&E is usually packed, back pain isn't considered too high on the list. When she was finally seen to, we discovered the source of the pain. She had tried to remove the carcinoma from her back that spanned from her neck to the bottom of the ribs. It had gotten infected, and to top that off, she had decided to use homeopathy to treat her cancer. How she had neglected to mention that or had survived so long still surprises me. Not a doctor, but this seems to fit the question. I recently had an attempted vasectomy where I learned I'm allergic to lidocaine and had to spend some time in the ER as a result. I was talking with the older doc, probably in his 60s and close to retirement. He relayed a story from one of his mentors who was a doctor in a small, rural hospital. This hospital, or clinic, closed down at night for the most part as there wasn't much need for it, and this doc decided that he and his wife had enough kids and decided to give himself a vasectomy by himself. In the middle of the procedure he passed out, came to a few minutes later, and finished the procedure. Not at all DIY, but one of my friend's dad back home was a doctor, and he had a patient come in with 5+ snake bites, mostly on his hands and arms. The patient said he got bit by a snake and tried to catch the snake so he could bring it in for the doctor to identify it. Luckily the snake wasn't venomous. Right idea, bad execution. The actual right idea is to not catch the snake. Medical staff doesn't really need to know the specific species of snake that bit you. Saw a young child, about age 6-7, with a bruised, swollen, crooked forearm. He had fallen on the playground 3 days earlier, and another parent there was a vet and had horse x-ray equipment in his truck. That parent took x-rays and told mom he was probably fine. So that was apparently good enough for mom, and she didn't do anything for 3 days while he was up all night screaming in pain. Finally she took him into my office and brought me the fuzzy copies of the x-rays, which were useless and impossible to accurately interpret. I got him real x-rays and a nice cast for his broken arm. This patient wasn't one I saw, but my brother worked for a PCP in our hometown. There was a guy who had a rare condition that required bloodletting, but he didn't have the money to afford the treatment as often as he would need it. Like any rational human being, he decided to build an apparatus at home using a shop vac, mason jars, an IV needle and surgical tubing. So he had no issues for a few weeks. Just set the vacuum to pull the blood through the tubing via the needle and drain into the mason jars. No big deal. One day he isn't paying attention and sets the vac to blow instead of pull. Dude switched it off after a few seconds, but he still had a massive air embolism. He's very lucky he didn't die. He just had a major stroke. He goes in for treatment now, the last I heard. Holy heck, I had a heart attack when I read he set it to blow. I remember I was rolling in stomach pain and went to the doctor because my mom could not stop giving me chamomile tea all the time instead of actual medicine. It was not my stomach. I went directly to her since one of my ovaries was full of cysts and some of them exploded. Update. I took the Plan B pill and according to the doctor those cysts were caused by the pill. I don't know what to think about that. Update 2. This year it was my second time taking this pill. My body recognized the medication and did not have other reaction than my period coming 3 days before the estimated date. From now on, since I am child free, I will save money in order to go to a clinic and having spay-neuter surgery. Oh man, I am so sorry. I have cysts on my ovaries and one burst. I woke up my roommate and my then boyfriend, now husband, came over, middle of the night, picked me up off the floor, and rushed me to the ER. In comparison to the contractions before I had my kid, the burst cyst was worse. I'm a doctor, but didn't see this firsthand unfortunately. However, my friend in ED saw a young 17-year-old boy that came in with personal trauma and mild blood loss. She treated him, taking him to a room with his parents and asked what he'd come in with. His mom turned around and said, "Go on, tell the lady what you did." He then proceeded to tell her that he tried to circumcise himself with scissors for religious reasons as he hadn't been circumcised when he was younger, but had to stop halfway due to pain. Eventually the shame had grown enough that he had to tell his parents, who immediately took him to ED, some antibiotics and a revision by urology later, and he was able to be sent home. Another one I know slightly unrelated was an older man that came in with swelling on his dong. He'd used an elastic band as a makeshift dong ring, but neglected to take it off. I have no idea why. He was a little odd to say the least. A week goes by and his dong starts to look literally like an aubergine. He then comes into the surgical assessment unit and we see him there and is booked for surgery the next day after we eventually picked our jaws off of the floor. He had literally killed all of the tissue in his dong to the point it was almost falling off. One full appendectomy later and he now only sits to pee. I'm not sure how he tolerated the first day. It must have hurt so much before the tissue died. Revision surgery means they completed the job. His mom was Jewish. His dad was not, if I recall. He was brought up secularly but wanted to take up his mom's religion. Woman I know has a dog that is epileptic but was not willing to medicate the dog for some time. She kept trying holistic remedies, one of which she informed me about was giving the dog all natural vanilla ice cream during a seizure to stop it. You know, because you should always try to put stuff in the mouth of a seizing animal. It didn't work. The dog is on meds. Seizures are controlled now. Imagine that. There are some weird conditions that cause low blood sugars occasionally in growing dogs. My brother's bulldog would get this weird little seizure tremor activity, but when you gave him a little ice cream, it cleared up incredibly quickly. That's probably what they meant to rule out, I guess. Not me, but my mom had a gentleman walk himself into the ED one day after he tried to give himself a vasectomy with an animal neutering kit he bought on the internet. When she asked him why, he told her that his wife wanted to have a 6th kid and it was too expensive to pay a doctor to do it, and how hard could it be to DIY. I now know that it's relatively cheap to get a vasectomy, which makes this guy even dumber. I also now know there's more than one way to neuter an animal. Thanks guys. I feel I should share. He tried to cut his testicles out essentially, and yes, they did indeed put them back in the sack and he could still make babies. That is a man dedicated to not having another kid. Guy had abdominal pain, drank a bunch of beer and tried to give himself an appendectomy with a steak knife on his front porch. Wife calls 911 after she see him performing seppuku. We roll on scene and ask him if he want treatment right to the emergency department. He looks up at us, looks down on the mess he has made, says, "Hang on, lem see if I can fix this first." He then tries to cauterize the wound he made with his cigarette, realizing that isn't working and goes, "Well crap, let's go, I guess. I fixed the coffee machine, Martha. I can fix myself too." I work in a pharmacy and one of the pharmacists that was there filling in that day told me that during his morning shift he had a woman call and tell them she pulled out her own IUD and wanted a painkiller recommendation. I cringed so much when he told me, as I had just gotten mine switched out that same day coincidentally and was still in quite a bit of pain from it. Turns out, there are DIY instructions on Pinterest on how to do this. This should go without saying, but please don't do this. Go to a professional if you want it removed. In Canada, so it's not like she couldn't afford a good doctor, as it's literally free. A friend of mine said her insurance pays to put it in, but not take it out. So she used Pinterest videos and removed it herself. She's fine and said it didn't hurt, but I cringed when she told me. Plus insurance is fricked up. If they weren't willing to pay for removal, they shouldn't pay to put it in. IUDs don't last forever. Not a doctor, but my grandfather was in decreasing health. Over the course of a few weeks he got to where he was having trouble breathing occasionally. So he gets the idea that he will go get an O2 tank to help him. Does he go to the doctor? Number. He goes to Tractor Supply and buys an acetylene torch, brings it home and hooks it up. Whenever he would get short of breath he would go in his office and only turn on the O2 before sticking the hose up his nose. I'm not a medical pro, but here's a story. My friend's dad got skin cancer on his right bicep, and at the time he was a large muscular man who ran a horse farm, huge arms, and so instead of going through all the normal BS of one getting skin cancer, he caught it early and thought he could stop it at the source. So he heated up a railroad tie steak with a massive torch he had on his farm, till past red hot, and shoved it into his arm where the skin cancer began. He did this twice, to himself, and wrapped up his insane burn hole in his arm. A while later he went to the doc, who said the burn he inflicted was the craziest crap he's ever seen. But all signs of the cancer were gone. He freaking killed that crap and it never returned. His arm and burn healed months later and he remains cancer free to this day. So sugar can be used to help heal certain types of wounds. A patient I saw had missed an appointment with part of their care team where they get their bandage changed. I noticed what appeared to be oozing around the edges of the bandage. Asked my patient about it. Offered to change it for them. We didn't typically do that in our clinic. They said yes. I go get fresh bandages and whatnot. Take the old one off and it's just sticky and stringy. Picture the slow-mo shots of caramel being pulled apart, and it smelled. To be fair, most wounds smell, but this was different. I finally asked them what they used to change their bandage since I knew it wasn't discharge. Maple syrup. They used maple syrup. Yes, honey, certain varieties can be used with wound healing, so it's possible they confused it with this, but I don't believe that's what happened here. Can't disclose more because HIPAA, the thing that doesn't seem to exist on shows like Grey's. No, I'm not sure it was pure maple. They said it was the good stuff in a glass jar, but who knows. Either way, it wasn't sterile and this wasn't a simple wound. Proper sugar dressings can be used on various types of wounds, but it's not just pouring some table sugar on it, so don't go trying this at home, folks. Necessary disclaimer. No, it wasn't Thousand Island dressing. There is medical grade honey. Studies show that it and medical grade sugar can actually be better for some wounds than antibiotics. No, I could not eat pancakes for a while. Honey dressings typically are less painful to administer than sugar because of the lack of crystallization, but that also means the sugar is better at cleansing. Your wound care specialist can determine which is the better route. Since this seems to be an issue now, no, HIPAA isn't just saying the patient's name. It can also be saying enough that could then cause them to be identified. Up to this point, I have not revealed anything that would link this story to this patient. Revealing more to the backstory would, in my opinion, considering I do not want to out this person as a human being or cause a willful HIPAA violation. As a now former professional, I won't go into the backstory, even with details changed as some have requested. Had to find the exact wording, but this is directly from HIPAA. The term individually identifiable health information means any information, including demographic information collected from an individual, that 3. With respect to which there is a reasonable basis to believe that the information can be used to identify the individual. I prefer to err on the side of caution with that. When I was a kid, like 12, I dropped boiling water on my stomach. Microwave accident. Babysitter had me put toothpaste on it. Even as a 12-year-old, I understood that this made zero sense. In short order, the burn started burning worse. I got it off and just left the wood to the air. Later on in a doctor's office, I was told I did the right thing. People are nuts. I wouldn't call it a treatment per se, but the patient did. I work in a home healthcare system. Patients have long-term IV accesses placed and are able to infuse sterile medications intravenously at home. Well, this patient kept getting really bad blood IV line infections almost weekly and having his line replaced. No one could figure out why, and line infections aren't very common. He also was running out of saline flushes a little quicker than he should with no explanation. So the line was being maintained appropriately at least. Finally, while a nurse was there to get labs, change his dressing, and check for infection, things finally clicked. He had been crushing pain pills, mixing with saline, and injecting it directly into his line. When asked directly, he didn't deny it. The response was, well, no one told me not to. Yes we did. We told not to put anything we didn't provide in there, and the pharmacy providing the pain meds put take by mouth on the little bottle. He got repeated painful infections, MRSA, and thousands of dollars in unnecessary hospital bills. Idiot. TLDR. If you put things directly into your bloodstream that are not aseptic, you're gonna have a bad time. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.